So first is like as all of you actually, and also the public, they know to everyone, is like the colorectal cancer, which is very common. No matter you are young and also maybe you're old, but the issue right now is like for the young people, which we usually call them like the age less than 50 years old, the colorectal cancer among the young people is becoming increasingly common. And also the trend among the young people, is becoming common. And if we see the new case rate, it's actually, increasing in the past 2 decades. But in contrast, it's like the rate among the older people, which larger than 50 years old, and their rate is actually decreasing in the past 2 decades. So I think many investigators, including me, we are very interested, like, what happened behind this. And another important issue for the young colorectal cancer patients is like they are more likely to be diagnosed at advanced stage. So it may be like stage 3 or stage 4. So there could be maybe limited things when we found them, when they presented to the clinic, and because they were diagnosed at very late stage, so there will be limited things we could help them. So this is why it motivated me and also my research team to focus on the survival of the colorectal cancer among the young populations, and to check like how we could, like, first is like there are actually a lot of conflicts or maybe different findings in this area, because some studies they reported like the young people, although they may be diagnosed at later stage, but they actually have like good survival, and some studies suggest like no, they actually not, because these inconsistent findings it actually confuse our patients, and also it could be hard for the patients, also for the clinicians when they see their diagnosis and so these things. So for our study, which we use a very large national cancer database, and we're really trying to get as many as the young colorectal cancer patients together and to check it. And also in this study, we use like very dedicated epidemiology study design, because you could say that it's like when we see the young cancer patients, colorectal cancer patients, they have like worse survival, we have to find a comparison group, right? So if we may compare them with people maybe over 90 years old, definitely we won't be surprised the young patients, they actually have like better survival, although they have cancer, right? But they are still young, so they're supposed to still have like many years. But how about like if we compare to people like maybe 60 to 65, or maybe 65 years old, older, people who already have like maybe they're eligible to Medicare, so exaggerate. So basically, I think for this study, we use a very dedicated study design to justify the people. We actually choose a comparison group is 51 to 55 years old. We choose this as a comparison group, and to really address like how it's important to pick this one and also focus on this one as a comparison group, and also compare with this and how is a real survival difference for the young cancer patients versus patients diagnosed at older age. So after very complex analysis, we actually found like the young cancer patients, although were reported to have like worse survival, is actually because they were more likely to diagnose at later stage. But if we take control of the stage part, and also really just exclude every other possible like influencing factors, etc., the young cancer patients actually have better survival. Although the better survival is just like 5% lower risk of death, but it's still like showing like you are young and you have like a promising future, and you should stick with this treatments, and also follow maybe other American Cancer Society guidelines for your lifestyle, etc. So you should not be, you should not like lose your hope for the future. So this is why I think this research is super important, and also AACR gave me the Scholar in Training Award because this very high quality abstract. And this award is only given to outstanding young investigators who will present research in AACR meeting. And also this award is very selective and competitive. So I really appreciate the recognition from AACR